We'd been trying for about 5 years and had nearly lost hope of ever having a baby when Esteban and I signed up for Christian Healthcare Ministries. Since it had been such a long time and we hadn't been getting pregnant, I'll admit I did pay little attention to CHM's guideline that members must join at least 300 days before the expected due date in order for those maternity bills to be eligible for sharing.
Probablemente solo porque no esperábamos a necesitar ayuda para un embarazo dentro de poco.
So then we were so surprised to see a positive pregnancy result about a month after we'd signed up for the ministry's Gold program.
Después de la emoción inicial nos dimos cuenta de cuán cerca habíamos estado a no ser elegibles para hacer que las cuentas médicas estén compartidas. Por suerte descubrimos que fuimos elegibles y pudimos pasar por el embarazo sin preocuparnos cómo pagaríamos los gastos médicos.
It was also such a blessing to have really clear instructions for submitting medical bills, especially they have a separate part for the maternity needs that was very easy to follow. So I was fairly comfortable with CHM's policy of seeking medical bill discounts. I had had a melanoma a few years before joining the ministry, and at the time I didn't have any insurance, and because of that, I already knew the process of asking healthcare providers for discounts. So even so, I did call the ministry several times because I just wanted to make sure that I was doing everything right. And every time, each staff member was friendly and they were patient with me as I asked my many questions.
Desde pequeño me habían gustado mucho los caballos. Era un sueño para mí tener mi casa y ser dueño de caballos y poder realizar actividades con ellos. E inculcar a mis hijos que hagan y poder enseñarles lo que tanto me gusta. Ahora somos dueños de caballos y usamos alambre eléctrico para asegurar que ellos no se hagan daño por acercarse demasiado a la cerca.
So my pregnancy was progressing normally until about 32 weeks. And then one day I was outside filling up the horse's water trough and I had to lean forward close to the electric fence and I forgot about my expanding midsection and my belly brushed up against the electric wire and immediately I felt this huge shock go throughout my entire body. So I had no idea whether the jolt could harm the baby, but I thought, for sure, he would at least wake up and I'd start feeling him move. I was trying not to panic, but it took everything in me to just calm down and wait a few minutes to see if he'd move, but he didn't. I did remember reading in Christian Healthcare Ministries that if you're ever in an emergency situation, which I wasn't sure how serious this could be, that you just go get the care you need.
Llamamos al doctor y él nos aconsejó ir al hospital para monitorización.
I went to the hospital. They hooked me up on the monitors. You hear the heartbeat right away, so it was very reassuring. I did feel a little embarrassed when about like 5 or 10 minutes later, he started bumping around everywhere. He didn't want to put my mind at ease on the drive there, but when I got hooked up, he did move around and whatnot. So I was there just for maybe an hour. And, I left. They knew that I was under the maternity contract because I'd already set that up, so they knew they were going to bill me.
El gasto de la visita al hospital fue el último en lo que pensamos. Después de algunas semanas llegó la cuenta y me dejó boquiabierto. El cargo fue más de $4,000. Intentamos obtener un descuento para la cuenta, pero nos dijeron que el hospital solo negocia con terceros. No estábamos seguros si el cargo sería incluido bajo nuestro incidente de maternidad, así que llamamos a CHM y de inmediato nos dijeron que no había nada de qué preocuparnos. Con la ayuda de los empleados de CHM fueron capaces de recibir un descuento de 25% para esta cuenta.
So I went into labor a few days after my due date, and the next 4 days I had sessions of strong contractions, but I wasn't dilating enough to be admitted to the hospital. So because of that, I was getting very little sleep and I was suffering from the back labor, which I later learned was because our son was in a position with his face up rather than face down, where his skull was pressing up against my pelvis every time I had a contraction. So even after I was dilated enough to be admitted to the hospital, my labor just kept stalling out.
Pasaron algunas horas antes cuando por fin una enfermera nos dijo que la cabeza del bebé estuvo inclinada hacia su hombro y no estuvo en la posición correcta para nacer. Tuvieron que hacer una cesárea de emergencia para ayudar al niño a nacer.
So the minute I saw the face of our little Janelle and Esteban Barradas, I forgave him for all of my pain. You know, in our eyes, he was perfect and perfectly healthy.
Los cargos del parto habrían sido más de $30,000 si no hubiéramos establecido un acuerdo de pago por adelantado, lo cual solo fue $6,400 y CHM compartió el resto de la cuenta. En todo tuvimos 65% de descuento y miembros del ministerio nos ayudaron con los otros $15,000 restantes en cargos de maternidad. Unirnos a CHM fue una decisión excelente para nosotros ambos, económicamente y espiritualmente.
Sometimes I do wish I'd heard about the ministry sooner, but I'm just so grateful for God's perfect timing. And I love how every month we receive a card with our billing statement that lists a fellow member that we can pray for.
También apreciamos la oportunidad a referirnos a la página de oración en cada edición de revista Heartfelt y elegir a alguien a bendecir a través de nuestras oraciones y donaciones.
CHM has been so amazing in how they've supported us. It was so wonderful to be reassured throughout my pregnancy that I was not just a number to them, but rather a sister in Christ and a recipient of fellow believers' thoughts and prayers. So now, as we're preparing for another baby, it's so comforting to know that fellow members will be there for us.
Damos gracias a Dios por CHM.
It's such an incredible ministry, and we look forward to continuing to help carry each other's burdens.